We've received a lot of very positive feedback from our program that we do with Dr. Anthony Davis pertaining to dementia, Alzheimer's. Dr. Davis is back to visit with us. Hopefully, you've gotten some of that feedback as well, but we appreciate you taking the time out
For
of a
sure.
busy schedule to give some people some insight into this, because this is it's a subject we should be talking more about, but it's not always easy to talk about.
For sure. It carries a stigma of kind of end of life and really terrible cases. And of course, those can happen, but there's still many dynamic people that are active and in the community and doing things that may have a little bit of trouble, but are still very functional. And so I think it's important to open these conversations earlier rather than later and try to talk about it with family members if there's some kind of concern.
Let's reflect back on some of the symptoms of dementia.
Absolutely. So the definition of dementia is fairly broad, but it's a change in cognitive function that impairs life in some way. And so cognition is not just memory, it's also decision making, language function, planning, able to follow through with tasks. And so it's not just only about the memory, but if there's been a change in the person's thinking or cognition and it begins to affect activities of daily living. So beyond just lost my car keys, or I missed an item that I wanted to get at the store. It's beyond that where you start to have some difficulty with things that previously you could do successfully.
Do you see, and one thing that I've heard from people, you'll find you're missing something, and then all of a sudden you find it in a place it really doesn't belong, like your car keys in the refrigerator. And that's kind of an offbeat sort of example, but I know people that's happened to.
It definitely has happened. And one of the common things that people come in and complain of is difficulty with multitasking, or kind of short-term memory where they have conversations and they don't really remember those later. And there can be a element of what I call a busy mind, or a juggler that has too many balls in the air. And so if there's a lot of stress in the life, if there's a lot going on, if you're trying to make a big life change, if you're moving or remodeling your house, or you're got family things that are going on, your brain can keep working on those problems even when you're not consciously thinking about this. And I think most people have had that shower eureka moment where they realize, oh my goodness, this is how to solve that problem, or this is what I did with that envelope that I lost. And it's because the brain can continue monitoring those things even when we're doing something mundane like taking a shower. And so if the brain is overloaded, it's got a lot of problems that it's thinking about, sometimes that reduces concentration, it reduces attention span, where those little absent-minded things can occur. And I usually tell patients, if you're not paying attention to when your spouse or your family are telling you you have an appointment next Friday, then you may not have really forgotten it. It was never there in the first place because there was a reduction in attention span.
Another question, and this is kind of a two-faceted question. Are there ways you can reduce the risk of dementia, and what are those?
So there's been quite a bit of study looking at potential risk factors or things that people can do to change the possibility of them getting dementia. And so one of the first things that we look at is medications. And medications can sometimes mask dementia or make it seem or mimic dementia. And so one medicine in particular that I have tried to get patients to stop taking is a lot of Benadryl. And so Benadryl sneaks in to our medicine cabinet because it's in most of the over-the-counter sleep aids. And the chemical name for it and what it'll say on the box is diphenhydramine. And there's been studies that have looked at patients who took long-term high doses, especially Benadryl containing products, and that may be associated with an increased risk of dementia. And so, even in the long term, I definitely don't want patients to take that nightly for sleep. These products don't necessarily advertise that that's the chemical that they're using, but ZQuil, Tylenol PM, Advil PM, they'll have a main ingredient, which is like acetaminophen in the case of Tylenol, but then they'll also have diphenhydramine with it, and that's what acts as a sleep aid. Of course, if you need it for a bug bite or some sort of allergic reaction, that's fine, but where I get concerned is when it's long-term usage or especially high doses. One of the first medicines we use when someone is diagnosed with Alzheimer's disease is called donepezil, or brand name Aricept. And what that chemical is trying to do is boost a chemical within the brain called acetylcholine. And we're trying to increase that because it can improve cognition. Well, there are medications that can reduce the amount of acetylcholine within the brain, and diphenhydramine is one of the main ones that can do that. Other bladder spasm medications that people take when they have urinary frequency, we watch those. Tricyclic antidepressants, which are kind of older school antidepressants such as amitriptyline, nortriptyline. Those are commonly used, but you do have to watch them because they can have what we call an anticholinergic effect, meaning it reduces the amount of acetylcholine within the brain. And so hydroxyzine is another one that's a weaker anticholinergic than the diphenhydramine is. But people take it sometimes for sleep or for anxiety, or, I mean, it's technically an antihistamine. So those medications can interfere with cognition, and we are worried about them on a long-term basis. A lot of the other studies have looked at just lifestyle. And so what I tell my patients is like clean living. So exercise, get out, get your heart rate up a few times a week, where you're doing the aerobic type exercise that probably your cardiologist or your regular doctor has already told you to do, seems to provide some benefit. Diet changes. We eat a lot of red meat. Most studies have looked more at a Mediterranean diet, which is heavier in vegetables, olive oil, more nuts, less meat, but very little red meat, more maybe fish and poultry potentially. But the Mediterranean diet as a change. Also, socialization, getting out, going places, talking to people. Going to church, going to civic groups, going to your friend's house to visit, all of those things can really help to stay cognitively aware and active. And then also activities. Get out, learn new things, pick up a new language, start a new hobby or a task or a group that you enjoy being part of. Really fire those neurons and get the brain to be as active as possible. We think all of those things could have a protective effect, especially when started earlier in middle age, but also after there's some concern for memory. I try to stress those things as well.
Talking with Dr. Anthony Davis, we're visiting about dementia, about Alzheimer's, associated issues. It seems like when we're young, it's almost a badge of honor to get by on about 2 or 3 hours sleep or 4 hours sleep. And in some of the studies I've looked at, a lack of sleep is also a contributing factor, or at least it's being looked at as.
Yeah, so our sleep hygiene as a nation is pretty poor. And what sleep hygiene means is having a dedicated bedtime, a dedicated time to get up, making sure there's enough hours in between those. The cell phones and the televisions that we bring into the bedroom is not good for that sleep as well. You know, your cell phone has a setting where you can decrease the amount of blue light after a certain amount of time to think that it maybe helps put you to sleep. But ultimately, any of those stimulating activities in the bed can disrupt sleep. Another large one that is thankfully being looked for, but not in every patient, is sleep apnea. Because sleep apnea is literally your brain waking yourself up so you won't die in your sleep. And that interrupts sleep because each time that happens, it takes you out of a deeper sleep and puts you into a lighter sleep, which is less restorative. And so, getting sleep apnea treated can help cognition. It also reduces stroke risk, heart attack risk. And so, ultimately, getting enough sleep and getting good sleep is also important, just daily to day life, but also long term, it has health effects.
If you have a loved one that you suspect is a dementia candidate, or you yourself you fear and maybe have gotten the diagnosis that that is an issue you're dealing with, what's the next step people need to think about?
So, of course, without any doctor intervention, you can do all of the things that I mentioned before about socialization, making sure that your risk factors are treated from a vascular standpoint because that has a role as well. So if you do have diabetes or you're a smoker or you have hypertension, to make sure that you have those controlled and to get those dialed in. But it's something to bring up to family and have an open discussion about without any stigma or without any idea that you're moving into a home the next day or anything like that, because that's a real fear with a lot of older people, that if they mention any concern at all, that they'll lose any kind of independence that they have. And then talk to your doctor. Or we're happy to help you at Davis Neurology. We have a specialized focus on memory care now, and it's something that I'm passionate about. And so feel free to call us, and we'd love to sit down and talk to you about it.
And I'm glad you mentioned that because we need to do this more often than that is remind people where you're located, what the telephone number is, and your social media, because it's through social media for many people that they can gather and garner more information.
Absolutely. And we're open to be contacted. However, you can stop by at 220 North Phoenix, which is right over the new overpass that they built about 10 years ago. Off of Main Street. Our phone number is 479-880-0101. We have a website. It's currently being revamped by Brainstorm. And so she's going to get it looking good, but it's at davisneurology.com. My email address is drdavis@davisneurology.com, and that comes directly to me. So any of those ways, we absolutely love taking care of these patients and love talking to people.
I know you and I talked a little bit about this before we began the broadcast, but I think you shared some information with me that is important. How does your life change? And for that matter, for the patient and for the caregiver, you've seen both sides of this. How does your life change once that diagnosis has been made?
So if it's early, there may not be much change at all. Often when I start talking to people, there have already been some changes, and I always hope that there is a safety net of family. One of the things that I ask about, for example, is finances. And so if I say, do you pay your own bills? Do you pay the gas bill when it comes in? And if the child or the spouse says, no, I'm starting to do that, and I've done it for the past 2 years, then that may be an indication that there was an earlier symptom that they maybe didn't consider that much, but there had been a change. But early in the disease, you can have continued life. You can still be autonomous, meaning you can make your own decisions. You can do all the things that you're able to do, whether it's active handling the household, driving, those kind of things. I want you to continue doing that. But I am happy when there is a safety net that if there is some difficulty, let's say that the medications are being taken incorrectly or not taken at all, that there's somebody kind of overlooking that can say, okay, this is an issue now, and we might need a little bit more help. The science shows that Alzheimer's disease begins in the brain long before symptoms ever present. And so, if you think about it from that standpoint, there are millions of people walking around that may have microscopic changes of Alzheimer's in their brain, but they're functional people. And so, it's not a immediate yes or no light switch that turns off, that the minute you get this diagnosis, you need someone to take care of you and to be your guardian. And so I really try to hold all of my patients' independence and autonomy as long as it's safe and in their best interest.
We think about memory, and we've talked about memory, but what are some of the other symptoms that can affect the life of the dementia patient?
So, one of the things that can unfortunately happen is some what we call behavioral and psychiatric symptoms of dementia, or BPSD. And sometimes these have the biggest impact on caregivers. And this can be anything from hallucinations. The most common type of hallucination would be more of a visual hallucination, generally, less auditory, although that happens occasionally as well. And it often presents as there was a little boy running down the hallway, and they'll report this to their family, and of course there was no person there. They're often silent. They usually don't have a lot of activity. They don't come through the wall like a dragon or anything magical typically. It's usually fairly mundane. Sometimes they know the person. Rarely will the person talk to them, but that happens occasionally. But if you start getting some of those reports, that can cause, honestly, a lot more distress for the caregiver usually than it does the patient. Sometimes they're not really bothered by them. But of course, if they're scary, such as the military is outside the window and they want to break in and things like that, then that certainly is more concerning that the doctor needs to know about. Another very common one is depression. And this is not, woe is me, I have Alzheimer's disease. This is a neurochemical change that occurs within the brain. And so we try to treat that. And so we try to look to see if the person's still engaging, if they still like doing activities that they previously enjoyed, how their mood is, how their interaction is, because that's something that's often readily treatable that we try to watch out for. There can be disorientation, and this can be very frustrating for patients, families as well, of this is not my home, I'm not in the right place, this is not where I need to be. And so that can be quite distressing. And what I try to stress to family members is that all of these things don't make sense. So if you try not to take offense to it, if they say, Aunt Cheryl came in and stole my handbag, if you have the reaction of, oh my goodness, Cheryl's known you since you were a baby, she would never ever steal from you, that really upsets the caregiver, and honestly it doesn't help much with the patient. That generally that's just brushed off, or you can provide as much proof as you would like that something they say is not true, and it really doesn't tend to matter to them. They'll move the goalposts on you where they say, well, that's not what I said. I said something different. And so it can be very frustrating. And so when I talk to families, I try to tell them, don't engage in that, because there's no amount of logic that you can present that can overcome some of these false beliefs, or what we call delusions, if those are going on. And there's ways that we try to change that with medications, but honestly, they're fairly disappointing at times. And so verbal judo, as we call it, is often one of the best ways to do that. And I try to empower families with some of those skills to be able to handle those situations if they arise.
Dr. Anthony Davis visiting with us. We talk a little bit about dementia, Alzheimer's, and some of the associated issues that are along the way. I know that I've been friends with, had family members that dealt with dementia, with Alzheimer's, and a total change in personality occasionally occurs. And it comes back to a question somebody asked me: are there safety issues people should be concerned about when it comes to dementia and Alzheimer's?
So this is where having the safety net of family around you can definitely be helpful, because often the patient will not report that there's a safety issue, and it can be as simple as driving. Although that's not a simple discussion, I have been called a quack and yelled at and cursed at because of this, and I understand that that is a huge issue, that ever since you were 15 or 16 years old, your car has been almost an extension of yourself. And when we start talking about safety with driving, then that becomes a very touchy subject. But I look for, are there, of course, tickets? Are there accidents? Are the neighbors calling and saying they're all over the road and in the ditch practically? But also navigation problems where they might get turned around, or they're having to ask for directions, or don't know where they are. We do talk about firearms in the home, and that can be sometimes an issue just from a safety aspect if you don't know how to work the firearm or use the action of it safely. Or if you do think that somebody is after you or someone's outside because you have one of those hallucinations or a delusion, could that be unsafe? And so that's a topic that we talk about. Something fairly mundane would just be food safety. That if you have trouble running the stove and you've caught the kitchen curtains on fire because you left something on the stove too long, unfortunately, that's something that you have to look at, and I've had patients' families who had to actually turn the breaker off to the electric range and go more with just a microwave type setup or something that's easier to use. And so those are issues that come up. But one of the biggest ones for all of my patients is falls. Fall risk is such a big issue, and if I've got a phone call today about one of my dementia patients and they're in the hospital, my first question would be, did they fall? And so Alzheimer's does not have to necessarily affect your balance and your gait, but it can. And also if you are getting tripped or falling down out of the bathtub, those issues cause a lot of injury very quickly. And so it should be looked at from a fall safety standard at the house.
You know, I talked about this last time, but I think it bears repeating, and that is whenever you have this sort of issue diagnosed and a family member does have the onset of dementia or Alzheimer's, you probably feel a little bit helpless because you know help is needed, but you don't know what type of help. What sorts of care do people need to look into?
So it can start with increased family support. Just let's stop by and check on mom a little bit more often. There are, with the area agency on aging, there's aides available. Home health cares can provide sometimes some aid help during the day. It's usually not for as many hours as we need, but that's just a limitation on the system. But they can sit with the patient and talk with them and just be kind of a companion all the way up through helping with some things, including bathing and some kind of things around the house. Further than that, assisted livings are good situations. There are ways that you can take some of those burdens off as far as medications and driving and cooking meals in an assisted living situation. One of the biggest problems with that is just cost, because that typically is not covered by insurance, but the assisted living places can provide a middle ground where the patient may not be able to stay in their own home any longer, but is not ready for a nursing home. A nursing home would be more towards the end, and that was typically more when the person needs more care, and they need more care than any certain family member can provide. There's not enough hours in the day of aides that can come over and help, and that can be very rewarding and fulfilling for the patient, and they can continue to have a good life and good existence there, but they just need a little bit more help on a day-to-day basis with all those activities of daily living.
I know you and your staff have been very kind to visit with people, answer these questions, and you urge people to get in contact with your office. What are some of the other resources where people can learn more and get some of those questions answered beside visiting with you and your staff?
Yes, so we've got a couple of things here locally that are good to make use of. On the first Tuesday of each month from 5 to 6 p.m. at the Dardanelle Community Center, Dardanelle Regional, which is now with Conway Regional, has a dementia support group. And so it can be with patients or caregivers to talk about some of these issues and realize that you are not alone, and to share stories and share things that can help, and feel like there is a better sense of community and more resources out there. That's moderated by a lady named Tiffany Horton, who works with Conway Regional. There's a workshop coming up that's being put on by Alzheimer's Arkansas. It's called the Hope Care Workshop. It's Friday, October 20th at 9 a.m. at the Central Presbyterian Church on 400 West Main here in Russellville. And so that's going to have a variety of speakers. I believe I'll be there giving a little presentation. But there are more resources to answer some of these questions, some questions you may not even know you need to ask, but resources there for people who are either concerned about dementia or maybe taking care of someone. There are some community resources, including this workshop, which I think will be very good.
If this is a help to you, if this has answered some of your questions, we extend our thanks to Dr. Anthony Davis for being along and visiting with us on a monthly basis. And if you enjoy the program, contact Dr. Davis. Let him know. Let us know. We'll continue to visit with Dr. Davis as he has time to do so, and we'll look forward to seeing you again real soon.
Absolutely. Thank you very much for having me.